First, we have Ana Maria Ibañez, who's the Vice President for Sectors and Knowledge of the IDB, who will be our moderator. We would also invite Roberto Angulo, Secretary of Social Integration, to come up to the stage. Then Carolina Trivelli, Senior Researcher at the Institute of Peruvian Studies. She's the former Minister of Development and Social Inclusion. And last, Wellington Diaz, Minister of Social Development and Assistance and Fight Against Hunger from Brazil. Welcome.
Wonderful presentation that sets really the scene for the discussion that we are going to have among all of us. Adaptive social protection is really important for the future, for achieving the goals of reducing poverty while at the same time boosting resilience to natural disasters. Esther already showed us many ideas on how we can proceed on that respect. And this is important for Latin America and for the Caribbean. The intensity and frequency of natural disasters and extreme weather events have been increasing significantly during the last decades. In fact, during the last 50 years, the frequency of natural disasters have increased 5- or 6-fold. And very importantly so, as Esther mentioned, our region is the second most vulnerable region in the world to natural disasters. I'm going to switch to Spanish. Pueden mostrar y mandar.
You may share your questions by sending them to this QR code. I will be receiving them, and I will be asking your questions during the Q&A. Latin America and the Caribbean has 200 million poor individuals. When we look at where they are and where they live, half of them are found in areas where there's high vulnerability or risk to natural disasters. Therefore, designing social protection systems that are adaptive is pressing. And it is pressing because social protection systems are the first point of contact, the first door to helping the populations mitigate the impact of natural disasters and other shocks that are occurring more and more frequently. I have a question for all panelists. I will ask it in English first.
And the question is the following. You have been, in your professional life, you have seen many crises. And I would like you to discuss which is the crisis that have contributed more to understanding the role of social protection. A todos los panelistas quiero preguntarle.
For the rest of panelists, here's the question. During your professional career, you've had a chance to witness a series of crises, and as policymakers, you've also seen crises unfold. What is your experience with social protection systems in that context?
Ana y Roberto.
So thank you. I think it's a privilege to go first because I think one has to say that the COVID-19 crisis is looms very large for various reasons. Number one, because of the intensity of the shocks, because it was everywhere, and because a lot was discovered about how quickly there was a need to adapt, and a lot was invented. In particular, a country like Togo, for example, in a matter of weeks, figured out how to get all of telecom operator to get together on one social platform to send transfer on people's phone. Then got together with University of Berkeley, and with the IPA to evaluate how they can transfer to people, and they did all of that very quickly. So I think we learned a lot in terms of the need for social protection. Also, there was a lot of consensus for social protection, which is pretty unusual, because at least you could see it's not their fault this time. It's not because they are lazy that they are poor, it's because of COVID. And a lot of ingenuity and creativity.
Sí, y es muy importante lo que mencionas.
What you said about consensus is important in the context of the pandemic and social protection. Latin America and the Caribbean already had a series of social protection systems in place, which enabled a quick reaction and the delivery of cash transfers to households. Minister Diaz, what would you say about this? First of all, let me greet all those present here. Our keynote speaker, Esther, who has helped us through the Global Alliance to fight poverty and hunger, also Roberto, who's worked with us, and greetings to all participants and to the audience. What we have seen is that we have an annual cycle of crises in the Amazon region. We have had forest fires, and also in Rio Grande do Sul, in the southern part of Brazil, we had 2.2 million people who were affected, destroyed houses, entire cities, which had it been in place months before, were totally devastated. Brazil had been getting ready because we know that it is important for us to learn to live with climate change and its impact. And I would like to mention that we set up a climate observatory, and that was already in place, and with using that technology, we were able to prevent many deaths. We also were able to use technology to integrate different systems. We have a committee who's responsible for that area. Minister Marina Silva is the coordinator. And the healthcare system, through its single healthcare system, was able to work with the social protection system. So these were individuals who were in place and were ready to provide assistance in an area like Rio Grande do Sul, and they were able to provide large-scale assistance. First, they provided services to save lives. They also delivered food, and they developed the medium and long-term plan for the prevention and provide protection through a series of measures. And after the first phase, it was important to continue providing support for rebuilding, to help individuals to rebuild their lives, also provided support for their businesses and for rebuilding activities. In Rio Grande do Sul, we were also providing support for businesses, and that is enabling the region to develop opportunities, especially for those who were affected and were left without resources. So we did see that many countries stepped up and provided us with assistance. The IDB also helped us with financing. And Professor Esther has described the challenges that are important for us to address, and to address swiftly in order to be able to save lives and provide protection more quickly to those who are poor and vulnerable, because they are the ones hardest hit by situations like this. Thank you, Minister. This is a very good example of why readiness is important. You had two major disasters in 1 year, which had sizable impact, but you were ready, and that made it possible for you to act quickly during the emergency and during the recovery stage, which came after that. It was also important for you to work with many different institutions and with the IDB, which needs to have financial instruments it can use to support countries in such a situation. Carolina?
Just wanted to go back to what Esther was talking about and talk about COVID. What we saw during the crisis, since it was complex and it had an impact on the ability to continue to get income as a family and livelihoods. That affected the poorest of the poor, sure, but it also affected the middle class and the poor and vulnerable who in our countries work in the informal sector, who pretty much live on a day-to-day wage coming in. And that's what we see in employment. And it's hard to know what the numbers look like in the informal sector. We saw that when the crisis struck, a lot of these people lost their ability to get that revenue because nobody was buying from these businesses that were informal. And this was affecting well beyond the poor who were getting assistance, and it led to that quick expansion of the social welfare systems. That was a crisis and an event that was unexpected. In the past, this is something that used to happen very acutely given a climate or weather event, El Nino, floods, an earthquake, for example. They, of course, have a huge impact, but with every crisis, we have learned not only how important readiness is for a quick response, but also the importance of being able to help those affected, no matter what income bracket they fall into. And the poorest suffered the most, and that meant that they also needed a different kind of support package than those who needed just some assistance or temporary assistance, and compared to, again, those who needed a more systemic approach to help them through. You mentioned something that in our countries can also make it very difficult to deliver social protection, and that's the informal works. We know that the informal sector led to a lot of vulnerability in our countries, and the segments of the population that fall into that category is part of it, sure, but also those working in the informal sector and who had made it out, but just barely, and so they fell back into poverty after that crisis. And so having the ability as a protection system to adapt to that has been key. Robert, I know you've been handling these kinds of programs for many years. Your thoughts? Well, thank you very much. I think that's a great question because it also talks about lessons learned on an individual level. I also believe that the biggest crisis I've seen working on these issues has been the COVID crisis. At that point, I was leading the social programs in response to the pandemic in Bogota, the capital of Colombia. And in Bogota, we went from having poverty at 27% up to 40%. In other words, the increase in poverty was beyond just 1 percentage point. That's unheard of in Colombia and in Bogota. Over the last 20 years, when we had seen the worst of the worst, we had never experienced a more than 1 percentage point of increase in poverty. And now we saw how that was building. There is a number of people affected by this situation that is growing. And what I realized is that through this, I just saw my own evolution in terms of looking at trades and looking at social protection. These segments of the population that all of a sudden were falling outside of these networks. And so you had, on the one hand, the poor and the vulnerable. They were not being covered by subsidy programs. In Bogota, we started to hear that there were folks who needed assistance because they were hungry or experiencing extreme poverty. And what actually they ended up doing was putting out a red rag, if you will, outside of their windows. And so that way you can get a sense of what was happening. And so we had to stay in shelter-in-place orders, and we had stay-at-home orders, and we started to see that those red rags were starting to hang on not only of the poorest windows, but also in the middle-class neighborhoods. We're seeing that the number of people that were falling through the cracks of the social protection program were beyond what we had thought. We were looking at those working informally and seeing all those people who just didn't have an ability to continue to have an income. There was another huge impact we had on the social policy in the district that comes from another extreme example, and it was really the poorest of the poor. We're talking about people who live in an almost day-to-day rent situation. They pay sometimes for as much as a week. And those living in these conditions, the first thing they needed is to be pulled out of that situation. And they were informal and didn't quite have another way to do that. And so all of a sudden, all of those living in that day-to-day rent situation were being found on the street. These were people who were kicked out of these buildings that had these kinds of arrangements. And so you had these two things happening at once, people that were falling back into poverty and also an exacerbated extreme poverty situation for people who weren't getting any of the benefits from the instruments that were available. And so that really changed my perception of public policy, of social policy, on the need for more organic social policy, and also a need. The need to be more unorthodox in terms of how we want to get information out. And I would say those are my takeaways, my lessons learned during that, and hopefully that can help with the conversation we're having now. Sure, and we're talking about these policies. We're talking about a 27 to 40% increase in poverty in Bogota. We're talking about a colossal challenge. And I, as a Colombian, can remember as these red flags started to be more visible in the city, people asking for help. Carolina, Robert was talking about being more unorthodox in how we target beneficiaries. Perhaps we can think about how technology can be useful in these kinds of efforts to better find those who need it, who needs assistance in a time of crisis, and also to evaluate and make adjustments to the program so that they're best fit for those who need it. Well, the last panel had great input in that area, talking about new technology, how to collect information, drone-enabled imagery, satellite images, and how all of that helps to really improve the targeting mechanisms we use. When you have a widespread crisis, what we need to do is use everything at our disposal and use it very quickly. And as Robert was saying, that means that you need to start using unconventional means to get things done, like asking people to put out a red flag of their windows, and being more innovative and being more flexible too, to really make sure that those who need help are getting it. There are several countries that used reverse targeting approach. They found an area that was affected, and what they did was they removed those who had dependable, reliable data that showed that they didn't need the assistance, removed them from the list. And that actually helped with a massive delivery of social protection resources to ensure that no one, given our constraints in data gathering, was left out with their hands extended, nothing going in. And so it required enhancing those systems, really fine-tuning the parameters, and opening at least two separate channels to complement the information. On the one hand, as Roberto was saying, we started to collect new information from people who had fallen out of these systems, again, the sort of disenfranchised, those folks who ended up being in the street. And locally speaking, they're usually not on any registry. And so we started to use community networks to better get an understanding of who needed help. Lots of new social organizations were starting to be created, and this is because, given the high informality rate, what we usually see is that the people those in most need turn to first are their family members. When you have COVID and those kinds of shocks, in this case, we're all in the same boat. And so that made it very difficult to think about social protection from those who are your closest family and friends without government assistance. The government needed to step in. And so we needed to also step in and look at those local networks, community networks, families, social networks, to get a better sense of who needed assistance and how to best ensure that nobody was not making it onto our radar. Now, when all of that information from informal and sometimes a different set of sources needed to be integrated, that's when we had another challenge, because then we had to deal with the differences in how this data was collected and how it was kept. And so AI helped with that process. We didn't have as much AI then, 5 years ago, during the pandemic, as we do now, but it really helped to make the processes more streamlined and easier. Technology was very useful. Something else that was key during COVID, Esther mentioned this, we already had almost everyone on their cellular networks. And so that made it possible not only to gather information, looking at what used to be, an actual phone call, but looking at text messages and that data, and then sending automatic direct payments to a very large network. The social development minister for Chile was talking about this. Financial inclusion was absolutely vital in ensuring that we had a channel for sending out assistance to everyone who needed it. That's why it's so important for all of us to be connected to these major networks, as is, for example, the financial network. Yes, when we talk about being prepared, we're talking about having the programs designed to actually be useful for the population, but also make sure that the bank systems can be integrated so that assistance can go out quickly. Minister Diaz. Brazil has really robust systems. You have Cada Único, an important registry you have of the population. And my question for you is, how has this tool been helpful for you in thinking about program implementation and response capacity during different kinds of crises? You shared a few examples of what happened during the wildfires in the Amazon and the floods from last year. How have these systems helped?
Hola, Ana María.
Ana Maria, this is a very robust registry. Recently, Brazil's economy faced issues. Poverty is on the rise, as is hunger, and we had 94 million Brazilians registered, 41 million families, and we were able to obtain a great deal of data. It's been 15 years. We invested in a new registry, which is more modern. It uses technology, it uses artificial intelligence, and it's a highly integrated database. It's integrated with the registries of the healthcare sector, education. There's 24 ministries participating in this database. There's the data is protected. We have never had any issues with that. So this is a tool which in and of itself makes it possible for us to contribute to Brazil's risk map. So we're able to pinpoint where the risk is, whether it's along the coast. It looks at where people live. And based on that information, we're able to develop a plan to help individuals. Because it is integrated with the health sector, we also are able to address food insecurity. It enables us to find where individuals who are experiencing malnutrition are and determine the cause of the problem and decide on how or what type of assistance they need. We look at schools, children who are enrolled, whether they are going to school. And this registry has also been important in enabling integration with the data of 41 programs. In addition to Bolsa Familia, there's also programs that provide assistance to individuals who are either disabled or the elderly who need special assistance. It's part of President Lula's vision. Poverty is not just about being able to deliver food and work. It's impossible to look at the individuals and their entire lives and look at issues like housing, also whether they are able to have internet services. Also, we have another program called Farmacia Popular. This makes it possible for individuals who are on medication to access them free of charge. So the funds that are transferred via Bolsa Familia can be used to buy food. We hope to end 2025 at the end of a 3-year period by pulling Brazil out of food insecurity. And this is following FAO guidelines. We've already seen a 4.4 drop. We're at the lowest level. Poverty reduction went from 36% to 27.4%. We don't have the results for 2024 yet. And we also saw the growth of the middle class. Individuals who are able to complete their studies, higher level education, and all of this is what makes people able to earn a living, address hunger, and also be able to provide a comprehensive assistance. And this registry is a very useful tool because it makes it possible for us to plan for the short, medium, and long term. And that's very important because it is an integrated exercise. Esther showed us her slide and the social protection programs. There are many dimensions, so the single registry is helping you for planning purposes for social protection systems.
To ask you now, you mentioned in your presentation that the poor population is disproportionately affected by disaster and by extreme weather events, and you show with maps, very compelling maps, that this is the case. What does the evidence tell us on how we can improve the identification of beneficiaries, but more importantly, and increasing the effectiveness of social protection programs? You mentioned some things about the effectiveness of social protection programs, but I would like you to go a little bit more deeper into the evidence about that.
So I think that if we're thinking of social protection program as a way of protecting people against extreme weather events, then we really need to worry less about targeting and identification and about getting to people quickly. So there, I think my bias would be to have good registries, to not worry too much about who is poor, who is not poor, maybe do some regional targeting, and then basically focus on the intensity of the event. I think in this type of situation, simplicity really rules, and exclusion errors are extraordinarily costly. And inclusion errors can be managed. I realize this requires a change in spirit, but I think this is what Carolina also mentioned. So I think one way to, in some sense, to think about targeting is to not think too much about targeting, but think about where is the shock. We now have excellent data to tell us where is the shock. So if you think temperature, for example, we could have rules to say, well, if in a particular micro-region, could be smaller than a district even, the temperature is above 5 degrees, is above 32 degrees for 5 days in a row, or 5 days in a month, everyone here who is registered on that database should get €5. And today we are in a situation where, as Carolina mentioned, the technology is such that almost everybody in the world is or can be connected to a way of getting money in their pocket, either via a no-frills bank account or via a wallet on their cell phones. I think in the Latin American region, it's probably everybody is already connected. In some countries, in other parts in the world, this infrastructure needs to be built so that we are ready, that all of the pipes are ready. But I think in the region, it's mostly there, and maybe not fully. Maybe there are places that we need to reach. And then once we have that, I think it would be ideal to have very simple triggers and just launch quickly, because the gain in acting quickly are just, in my view, vastly superior than the loss in reaching someone who maybe doesn't need it because, well, they were not here or they have air conditioning in their house and it's not so bad. So, and also I think it's very important to move beyond extreme events like floods and droughts towards temperature triggers, because temperature also kills directly, because when it gets too hot, that's not compatible with human life, and indirectly because, of course, all of these other events are often a follow-up of that. So in a sense, maybe if I'm not answering to your question, but I would move away from the stress about identification by focusing on, in some sense, identifying events and responding to them. And if the amounts of money are not very large, and if you ask people to be registered, to be in the system, then the people who don't need it, a lot of them are not even going to register because that's not enough money to be worth it. But anybody who needs it is going to put themselves in the database to make sure they're covered.
Yes, and I think we have, that message is quite common, no? You're saying it has to be simple. It's better to have errors, inclusion errors than exclusion errors, and we have to have simple rules. And it's very related to what Roberto was saying, okay, targeting is important, but we were too focused on targeting and identifying beneficiaries, and now we have to be very quick and very responsive, and then we can see how we can fix things along the way, and that's important.
And I think technology can help a lot, because the simple technology of measuring the weather is just getting better and better and better. So it's possible to target quite finely for the intensity of the shock also.
Yes, it's more important to go quickly than to
Totally.
Yes, to be completely obsessive about targeting. Roberto,
Roberto, I would love to talk about institutional changes. We've been talking about how to identify beneficiaries, how to respond more quickly. But you were just talking to us about what happened in Bogota, and that was because the institutions simply weren't ready to quickly respond when the assistance was needed. Can you talk to us a little bit about the institutional changes necessary, or at least what should be ready for when an emergency strikes? Well, in Bogota, we saw several things. We have a national direct payment system that was working, and that helped in the city. But I guess I would summarize in the following way. The unorthodox approach, the technical approach I was talking about earlier, I think it means that you have to not be too much of a purist when it comes about targeting, just because you become inflexible. And that needs to be reflected in how your agencies are organized. When we started to deal with the pandemic in Bogota, in Colombia, there was, for example, a total control or takeover of how folks were working. So, for example, we had the database, and we said that you couldn't work more than 5 days a week, and that was uncommon for people. There were people in the street, and you had the control mechanisms that were worried about where the money was going, because some of the folks getting the money didn't necessarily need it. And so that was more about inclusion and exclusion than it was about anything else. And so the idea about thinking out of the box is to make sure that the people working in these agencies are also not afraid to be unorthodox, to do things differently. The money transfers and direct payments during the pandemic became a multi-sector approach. Before, we used to have a Familia Selección program in Colombia, and that focused on nutrition and education. But during the pandemic, we started to see how that splintered into multiple initiatives, and it started to mix with the social protection program. There was assistance for the elderly, for folks living with a disability, very specific profiles for people who needed help with nutrition. And so it became a multi-sector approach. In Bogota, we created something that's still operating today. Right now, I work in social integration, and that institutional network is still working today. We put together a cross-sector humanitarian transfers committee, and that really helped bring it all together across the board. And that meant that during the emergency state of emergency declaration, we can use social policy budget funds and use them for direct payments during the pandemic. And in the fiscal design and approvals, a number of the senior officials would come together for the districts and be part of the decision that came out. And so we started to see that network build, and it was great because it wasn't just about transfers that fell under one specific agency, but these multi-stakeholder organizations that were tapping into social policy to get all of the different kinds of assistance out. In terms of the interagency arrangements, in the work that I'm doing now in social integration, this is something that I started working on too. We started to see that there were wildfires, or fires, I should say, in Bogota. We started to see the effects of climate change that we needed to address. But there was already a transfer system that was established. The coverage has been increasing. And we were not able to send money to any of those affected by the fires because they weren't in the category of the poor and vulnerable. And so they weren't on the database, or at least on the right database. And so we had to make adjustments to make sure that the direct payment system could be adjusted to take into account direct payments for people affected by climate change, as Esther was just mentioning in her presentation. This ex ante intervention. And that's not something that we're used to. We're used to having lists and targeting people and seeing if your name was on that list, and looking at different categories, the municipalities and the areas that were affected, and what list can I check for that. But now we have the regulation that allows for these kinds of transfers to take place when they're linked to climate change. And that's really important too, making sure that the institutions are ready to deploy all of these different transfers. My apologies, I'm looking at my phone only because we have questions from the audience here. So I'll start with that. Minister Diaz. I want to ask you this question because Roberto was talking about local government and how important local government can be. The question here is, you discussed how important it is to get to where the poorest need you quickly and go beyond just what the federal response can be. There are other states in Brazil that have been able to provide social protection quickly in the face of those disasters?
Sim, eu devo reconhecer.
Yes, I would have to say that in Amazonia, Rio Grande do Sul, and other states in the Northeast, albeit there are differences, mostly of a political nature, but let me just remind you of one thing. We do have a regulation in Brazil which calls for that integration. We have all three levels of government working with the society and with the private sector, and that is what has made it easier to respond quickly. The local government has partnerships, for example, with the unified healthcare system, with both the federal and state governments, the unified social protection system, also the education system. Because of that, we were able to deliver assistance at the local level. There was better planning capacity at the regional level. But in addition to that, there was the involvement of the federal government working in different sectors. 24 ministries work together. They're part of the federal government, and they were all part of this effort. So it was important to be able to work in the context of the crisis by providing lifelines, as I said before, but also to have longer-term efforts in order to work with other ministries like the Energy Ministry, among others, together with healthcare system and education. So if we do not have a perfect system, it's still possible to make progress. But the main message I would have is that it is important to work with a budget and to be ready, because we know that in 2025 we may be facing similar climate events. So we need to be ready, and this has to be factored into the budget. So we need to make sure that we earmark the necessary resources. And what you said is interesting. You do have different layers of government. There's a federal level of government, you have the regional level, and also the local level. And the local level has the most capillarity. So it's important to be able to have these different layers work together and to perform their corresponding role.
You shared a lot of evidence from different parts of the world. How transferable do you expect findings on adaptive social protection to be to Latin American contexts?
I think I also tried to share a number of case studies from Latin America. I think a lot of things are transferable, and in particular, more the conceptual lessons than the detail of the program remain usually quite transferable, especially when we have, studies after studies that tend to show the same thing regardless of where they are. So obviously, the problem of Togo are quite different from the problem of anywhere in the region, but the problem of very poor people exposed to very hot temperature are in fact probably not dissimilar here or in other places in the world. I think what is an advantage here is that there is more infrastructure to get to them.
But I would say even that if we look within countries, in some cases we have some regions that are quite isolated and very poor, in which lessons from other countries, less developed countries, can be very important for a region. No? You can find that within our countries.
Absolutely, and other things, for example, if you look at the impact of cash transfer in general and what people do with how well they're using them, there is a review of literature from 72 cash transfer all over the world. Many are in the region because the region has been kind of a pioneer in cash transfers, and many are elsewhere. And what is very striking from this, I think it's a review of 130 studies from these 72 cash transfers, is that you get very, very concurrent results, which is that people are making excellent use of the money. And in fact, you have, when people get more money, they work more, not the contrary to what some people would have believed. And it also helped them, of course, with food security and health and everything else. And of course, one study was pretty encouraging, but when you have 130 studies from all countries in the world, including many in the region, you get even more sure of the quality of this result, which makes me pretty confident that using cash transfer as a part of, as an insurance tool would be quite powerful.
Yes, and something that you mentioned that I believe it's very important for us in Latin America and the Caribbean is that we have innovations that are important to bring to the world as well, no? And social policies, we have done some interesting innovations that are also can bring some examples to other countries in the world. Carolina,
I would like to ask you the following question. Esther mentioned that these adaptive social protection programs are expensive and don't have an immediate financial return. So in our context, in our countries, how have these programs been funded, and how should they be funded going forward? Well, it's clear that for our countries, the pandemic was a lesson. We learned that it was important to have fiscal account resources set aside to deal with these circumstances. Unfortunately, over the past 5 years, we've seen our fiscal position, at least in most countries, deteriorate. So we need to begin not just to consider it a top priority to have fiscal savings set aside to deal with any emergency, hopefully nothing as major as COVID, but we also need financial instruments that enable us to act quickly. Contingent credit, for example, credit that can be activated quickly in the event of an emergency, but for these external financial resources to be effective, not only do we need to have our fiscal affairs in order, because otherwise this gives rise to other problems down the road, but we also need to have the institutional arrangements Roberto mentioned. So it's not just about having one social program for emergencies. We need to have mechanisms so that in the event of a climate event or risk, we're able to divert funds from other programs, move them from other levels of government and other uses, and use them, channel them to address the emergency. So that is what is meant by adaptive. We need to be ready before the emergency, not just do what we can once the emergency is unfolding. So we need to have the resources in place and be able to access them quickly. So this may call for different funding structures, but we also need to have the institutional arrangements that enable us to reuse or to use those funds differently. One thing I'd like to highlight is that what is very costly for our countries is not just accessing the resources, but it's having to address what happens to people we are not able to help. I think the cost of providing assistance during the emergency is much lower than that of dealing with the problems they may face after the emergency if they don't receive assistance. So the fiscal side is also important. This is what Roberto was saying. And I'd like to plug something the IDB is doing. We are redesigning our financial instruments so that we can be better equipped to help countries in the context of an emergency. Esther?
I wanted to add something. Perhaps it's easier for me because I'm not a minister or an ex-minister of part of the IDB, but I think it's important to call the elephant in the room at some point. We are talking about fiscal expenditure. We need fiscal resources to match them. And that, of course, fiscal capacity within countries is something that needs to be addressed. That's a problem that a lot of Latin American countries are grappling with. But if we're talking about climate change, it is an international problem. And we have to think, it is very important to think about an international fiscal solution to this. And we have friends from Brazil here, and during the G20, they really put on the agenda the idea of coordination on international taxation, and in particular, international progressive taxation. And I think that agenda has to remain on the table because otherwise, it's just going to, I think Carolina is absolutely right that the cost of dealing with this crisis ex post is so much larger than the cost of dealing when they happen. But those countries, even middle-income countries, literally don't have the money. And we could say, well, we don't have the money, that's unfortunate. They also are not able to borrow a lot. We saw that during COVID, contrary to the rich countries. But the money exists at the level of the world, and it's very difficult for every individual countries to go after taxation in an aggressive way, because there is always the risk that people move with their assets or the companies move with their assets. And of course, if it's done regionally or internationally, as was started in the G20 process, then that's much, much easier. So I think that agenda is absolutely critical to make sure that we are actually ready in reality. We don't have just the pipes, but we also have the money to send into the pipes.
Thank you very much. Roberto,
Roberto, I have a question, an important question for you. How do you ensure that people who come out of poverty don't fall back into poverty if they lose their job, get sick, or have to contend with a natural disaster or some other type of event like the ones we've been describing? I think that we need to think of the chain of services we need to deliver once these adaptive programs begin to work. What that does is it makes it possible to respond quickly in the short run to prevent the population from falling into even a worse position, but there needs to be a protective shield. And I share what Esther and Carolina have said. It is a moral imperative for us to provide assistance, but we can't just do nothing in our countries. But we also need to be aware of the fact that the cost of a crisis can be extremely high. Colombia has not yet recovered from the impact that poverty had on young people and women. It affected labor markets and productivity. What happens after the safety net? We need to have social protection systems that take into account markets and productive integration. We need to have cash transfers that can migrate, whereas the Minister for Chile said cash transfers that become part of a social ecosystem. Our social policies must be able to connect with the job opportunities in the market. So the economic inclusion component, financial inclusion, employability, entrepreneurship, or boosting the productivity of the 40% who are at the bottom, all of that, we believe, needs to be connected. And to prevent people from falling back into poverty is to get them out of that zone of volatility. So it's not just about a social safety net, it's about productive inclusion for that population. And everything we've been discussing has to do with this. Carolina was mentioning what we need to do. After the pandemic, we started to expand transfers. It's as if we had laid down pipes. Once we have that piping, people are connected, and we need to see how we can use it, how it can become a sort of nervous system. In addition, how do we convert it into an ecosystem with demand side and supply side actions, with targeting for individuals, for population groups, for geographic areas, or with areas that are prone to climate events. So we need to have a more organic system that can help us address the needs of different individuals and different groups. And all of this has to be linked to the market. It cannot be something we do on the side. It has to be done with the labor market, taking into account the importance of employment and of education. So that ties in with what Wellington was saying. All of that, all of those elements have to be part of the social protection system and also must share registries. One last question. You have 1 minute to answer because we do have to close.
1 minute for each one of you, and it's the same question for all. Yes, díganme.
The question is, could you mention one change in the current protection systems you think is pressing if we're going to deal with future crises?
To the future crisis that may emerge. Vamos a empezar, Robert.
And let's start. Let's go in this order: Roberto, Carolina, Wellington, and Esther. You have 1 minute. Much has been said about climate change, and I would like to mention something that is closely related. It's an area you know well, and it's migration and forced displacement. Colombia also has covariant crises, and these populations come, and they're somewhat invisible, but they're coming in. We had a displacement in an area called Catatumbo. That population came to Bogota, and they're invisible. They're not covered by the social policy radar. So what happens with these populations that are not being seen? They're not being considered. Those are likely to be the population groups that are most invisible. They don't have regular housing, and they are not captured by the system. So that's one thing I would like to address. Carolina, I'm going to say two minor things, and one has already been mentioned. We need to make sure that each country has an institutional or legal instrument that is triggered in the event of an emergency, as Esther said, by a very clear trigger. Temperature goes up, there's a crisis, there's a dengue outbreak. That would trigger the mechanism that gives the public sector Roberto said that we are good in an emergency. We know what to do in the event of an emergency: a cash transfer, temporary housing, water. But after the emergency is over, we tend to leave these families on their own. We don't give them housing support. We don't address their mental health issues. So we need to have complementary programs that take care of those who are able to survive the emergency so that they can go back and rebuild their lives, not just in economic terms, but also when it comes to housing, community, and mental health. We have a new tool, which I think is very important. It was created during Brazil's presidency of the G20, and it's the Global Alliance Against Poverty and Hunger. And that initiative is committed to providing protection for climate change. We have 72 members in this alliance. And the richest countries are part of it, as are developing countries. Some countries, 41 governments and a number of organizations set conditions for financial assistance, for providing credit in order to care for 500 million individuals who face food insecurity and poverty. The Inter-American Development Bank is one of our major partners. It announced that it would provide $25 million in order to support planning for the initiative. And together with others, Brazil has established a partnership in order to create a new program, which is called Acredita. It supports entrepreneurship, it supports businesses, because we think that it is extremely important to make an effort so that Latin America can be an example of how it is possible to reduce hunger and poverty and also address climate change. So we invite you to join us for COP30, which is going to be in the Amazon region, so that you can come and see what is happening there. Esther?
Most of my minutes have gone away, so I'll just be quick. If it's for insurance, it's simplicity, automaticity, universality or near universality are really what we should aim for. And then when we've said all that, this is just the insurance part. And I want to, because we talk mostly about that, I want to really emphasize Carolina's point that the whole point of development and poverty reduction remains untouched by that. And we still need to worry about schools and other things. That's why extra some money needs to be raised in order to take care of this insurance function, so that the rest can then be taken care of with the normal, financial means that the countries have at their disposals.
Bueno, hemos terminado, hemos tenido.
That brings us to the end of this panel. We've had a very good exchange about how to develop adaptive social protection programs, not just for emergencies, but also for subsequent stages to keep people out of poverty. Thank you, everyone, and thank you to our panelists.
Un aplauso muy fuerte a nuestro.
One big round of applause for the panelists. Thank you for your presentations, and thank you to all those who've been with us for this first day. We have several more days, and also those who joined us via the app or streaming platforms. We invite you to come back tomorrow.